Minister of Health and Social Services, Dr. Kalumbi Shangula, is one of the government officials who also went to assess the impact of the flood on health infrastructure and services at affected areas in the northern regions of the country. NBC senior reporter Ndapanda Shuuya is there to update us on his visit. A very good afternoon, Ndapanda. What was the minister's reaction to the flood situation?
Good afternoon, Kalunduka. We are coming to you live from Ohaingu village here in the Ohangwena region. I'm joined by the Minister of Health, who will be briefing us about his current visit to the northern regions. Today, this afternoon, he visited the Ngela District Hospital. Dr. Shangula, thank you for joining us.
It's a pleasure.
Yeah. Can you please briefly tell us what is the core essence of your visit to the northern regions?
Yeah, first of all, I kick off my annual regional visits on Monday with a visit to the Zambezi region, and then on Tuesday I started with the Ohangwena region. I'm visiting basically the 3 district hospitals. I started with Okongo yesterday, and then Enhana yesterday, and today I'm in Ngela district. And apart from that, I also visit the satellite clinics and other places of interest to assess the service delivery, to talk to community leaders, politicians, how they perceive our services to the community, to hear from them, and also to exchange views.
Doctor, you have been talking to us about this afternoon. You were in a meeting with the leaders of the Ngela District Hospital that has been in the news over the past few weeks about alleged lack of space as well as a shortage of critical medication, and amongst others also the mortuary is said to some of the cabinets are not working, but you kept referring to the fact that some of these challenges will be addressed in the controversial condom tender.
Yes, it is correct that during my discussions with the management since this morning, actually, in Ngela Hospital, they brought to my attention some of the issues, the challenges they face, but mostly they emphasize the positive improvement which has taken place in terms of the increased number of doctors. Now we have about 12 doctors at the Ngela Hospital, which have never happened before, and the number of nurses have increased, the number of offering has increased. But of course, I recall the fact when Ngela Hospital was being constructed, I was a regional director in this whole northern region, and that time, that was almost 30 years ago, the space provided for was sufficient for the population at that time. But we are now seeing that the population has increased, and also they informed me about the big number of Angolan patients who are actually being treated in the hospital. So we have been discussing about the possible expansion. Of course, Ngela is one of the hospitals which is for upgrading to the intermediate level. I share the information with the management and also the preparation what we are doing in order for us to achieve that objective. So it was a very pleasant meeting, and we have to expand the hospital because of the growing number of patients, because of the growing population in this area, and including our neighboring patients from the Angolan side. But it was a very fruitful meeting, and some of the challenges they are being addressed, and some of the issues which are still lacking, they are actually part of the 492 items which are on the current tender, which is currently being evaluated by the Central Procurement Board.
Mm-hmm. Doctor, I just want also to find out, since the water levels continue to rise here in the Ohangwena region, as well as advancing towards the Oshana region, patients are unable to walk to the nearest health facilities. What modalities have you put in place to ensure that those that are needing medical assistance are assisted promptly?
Yeah, part of my brief visiting this region is also to assess the impact of a funja on the health service delivery. I have been briefed by the management, and I also have been briefed by the governor of the region. I know that there are some villages where we have outreach points which are completely cut off and they are inaccessible. Even this morning, we have to arrange for one patient to be airlifted in order to receive the services. We are now trying to find out what will be the best way to ensure that those who are cut off from the services, they are not completely left out. We will explore all the possible means of transportation, either for the health worker to go to the villages or for those who need medical assistance to be evacuated from there so that they can get the proper treatment. We do not want to compromise on the health of the inhabitant. It is very critically important, and we are also making arrangements for possible outbreak of waterborne diseases.
During your outreach program, what will you be doing throughout the week? You said you will be here in the most affected regions, which is Oshana, or Hangwena and Msati. What will be your line of duty during these coming days?
I will visit different satellite clinics and health centers which are accessible by road. I will make arrangement on Friday for aerial views of the whole Funja and how it impacts on the service delivery and also on the livelihood of the people of this region. As I said, we have made arrangement and we make sure that services and assistance will be provided to the people affected.
Doctor, thank you so much. There you have it, colleagues. The doctor has spoken that no matter what it takes, they will make sure that they have given outreach services to provide health care for the masses that are flooded or that whose houses are flooded and are unable to go to the nearest hospitals. Ndapanda Shuuya signing out from Ohaingu village.